We're grateful for the opportunity to help Lisa and her family and other people, but it shouldn't require the intervention of a nonprofit law firm to help people get care to which they are entitled. Now, I would like to bring up some friends. Ben, Wendell, Jamila, come on up to the stage. To begin this portion of the summit, let's move around here so you guys can squeeze by. I'd like to take a moment to share some gratitude for our 2025 CMA Summit program sponsors and partners, Medicare Rights Center and Justice and Aging. I also want to thank our advocate sponsors, California Health Advocates, SMP, Senior Medicare Patrol, and Mansfield Family Practice. In addition, I'd also like to thank our Chiplin Social Justice and Advocacy Award sponsor, our friend and supporter, psychotherapist Jonathan Kirkendall. Thank you so much, John. During this segment, we are going to hear from Ben Belton, the inaugural Chiplin awardee and former CMA board member, who will share some remarks about our colleague, Chip, for whom this award was named. Then we're going to hear from our friend and colleague, Wendell Potter, President of the Center for Health and Democracy and previous Rockefeller lecturer, thank you again, who will help us introduce this year's Chiplin awardee, Jamila Headley, Executive Director of Be a Hero. And of course, we will hear from our Chiplin awardee, Jamila Headley, about which you will hear more. So Ben, why don't you come on up?
I don't know if you heard David just now. He whispered in my ear that he didn't talk trash about me this time, as he usually does. Well, thank you all so very much, and good afternoon. It's so wonderful to see you all. I see so many old friends and colleagues, folks I haven't seen in a while. I hope that you and your friends are all doing well. It's so wonderful to be here and to be in community with like-minded people. This really has lifted my spirits being here today. I also want to give greetings to our dear friends and colleagues who are watching us via the live stream. It's wonderful that we can have this hybrid approach to be in person, but also have our good colleagues and friends joining us from around the country. Let me first recognize the center staff who had anything to do with putting this program together. It's a wonderful program. I know you do a lot of work with logistics and programming, so why don't we just give the Center for Medicare Advocacy staff a big hand. And even you, David. I'm going to be really brief, and I just wanted to be here today to share a few words in honor of the memory of our dear friend Chip. He was a man who dedicated his life and his career to serving others. In these challenging times, I've thought a lot about Chip and his vision for our society to make our society one where we have health equity, civility, and decency, and really justice for all. So many people have a better quality of life because of Chip's efforts, his advocacy, and his action. People who are on Medicare, their families and their caregivers, thousands of people around this country are better off because of Chip. And he did his work quietly. He didn't need a lot of fanfare. He didn't need a lot of applause. He didn't even need to see his name in lights, which is one of the reasons why I love to always recognize him and his contributions. One of the ways that the center keeps his legacy alive is through the Alfred J. Chiplin Social Justice and Advocacy Award. I'll give anybody $20 if you could say that fast 5 times. This award recognizes someone who has made a lasting impact in furtherance of Chip's mission. Jamila, congratulations on receiving this year's award. Like Chip, you are a transformational leader. And thank you for the leadership that you have had in this country, but also around the world where your impact has been felt. I know Chip would have been so proud. I could see him now. He would have been beaming across this room with his smile, knowing that you are receiving this award in his honor. I know that none of us who ever worked with Chip will forget his kindness, his smile, or the courage he showed in the face of overwhelming challenges. Even near the end of his life, he kept showing up for others. I mean, he showed up for me the day when I received my award, and he gave me some really kind, wise words of encouragement that I carry with me in my heart even to this day. Even in the face of his own mortality, he kept making a way. And just thinking about him now just makes me really emotional, because he told me that he was proud of me. And that is something that I have just never forgotten. His example inspires us to take action, to stay in the fight for justice, and to support those who need it the most. Even on tough days, his legacy motivates me to want to be a better person, to want to do better, and to want to make a difference in someone else's life. Now I have the pleasure of introducing another agent for change, someone who's no stranger to the summit, Wendell Potter, who is the publisher and executive editor of Healthcare Uncovered. He also leads the Center for Health and Democracy and the Lower Out-of-Pocket Now Coalition, and now is in all caps. Wendell isn't playing, he means business. That's my kind of coalition, Wendell. So thank you for all you do, Wendell. Jamila, it's wonderful to meet you, and congratulations for all your work. And David, I guess it's good to see you as well. Thank you all so very much.
Thank you very much, Ben. David, thank you all for this opportunity to introduce my dear friend and colleague, Jamila Headley. Jamila is a movement leader and remarkable strategist whose brilliant mind is eclipsed only by her generous spirit and her big heart. She regularly signs her emails with big hugs, and anyone who's worked alongside Jamila knows the sincerity and authenticity of her big hugs well wishes. I have a lot of great things to say about Jamila's leadership in the movement for health justice. But before I get too far into that, I want to wish her a belated Happy Mother's Day, as she is a relatively new mom to an adorable young boy. His name is Shiloh. Jamila, I'm sure that your husband Max and Shiloh and your whole family are all very proud of your work. And we in this room consider ourselves very lucky that we can share you and your compassion and brilliance. Jamila was born in Barbados and came to the United States to study at St. Michael's College in Vermont, where she got her bachelor's degree in political science. Shortly after her graduation, while surfing back home in Barbados, Jamila experienced a sharp cramp in her thighs, and hours later was in the hospital, unable to move her legs. She was diagnosed with a rare neurological disorder, transverse myelitis. Through the support and advocacy of her friends and family, Jamila was able to get the initial treatment that she needed, but this experience solidified what she already knew about the U.S. healthcare system. She said that for every miraculous story like hers, there are too many others who suffer a sure fate of death, of debt, of prolonged illness, or of death. But like many other great leaders in this movement, including Adi Barkan, Jamila decided to use her story and her personal experiences to fight for others, especially those who were left behind by the system. Jamila went on to earn her master's in global health and PhD in public health, in global health and a PhD in public health from the University of Oxford, where she studied as a Rhodes Scholar, the first female Rhodes Scholar from St. Michael's College. She began her career as a program officer overseeing public health programs at Open Societies Foundation, and then went on to become the managing director at the Health Global Access Project, also known as Health Gap, where she worked with movement leaders and activists from 15 countries across the world to fight for access to HIV/AIDS treatments and quality health care. Before coming to her role at Be a Hero, Jamila was the chief of staff at the Center for Popular Democracy and CPD Action, where she led fights to advance racial and economic justice and spearhead a pro-immigrant and pro-worker agenda. Jamila joined the Be a Hero team in 2021 as co-executive director alongside Adi Barkan. Jamila and Adi fought together to protect nurses, increase access to masks during the COVID-19 pandemic, expand access to home care, and ensure that our nation's care workers get the pay and benefits that they deserve for their heroic work. I met Jamila in 2023 when she and Adi added yet another important fight to their plate, taking on Medicare Advantage and fighting to reclaim Medicare from greedy corporations like the ones that I used to work for. For years, many of us have been looking at Medicare Advantage as a major concern. We discussed the urgently needed policies to address the growing privatization of an essential public health program. Jamila and Adi brought a whole new dynamic to that fight by bringing grassroots voices to directly impacted patients and beneficiaries to the table. They started to convene academics, policymakers, and organizers to tackle this very big problem. And over time, we coalesced on a strategy to save this vital program that we often refer to as traditional Medicare. Our work is ongoing, but the immense progress that we have made to raise this as an issue and build political support could not have been possible without Jamila's kind-hearted leadership and strategic planning. After Adi passed away in 2023, Jamila remembered him at his moment at his memorial by sharing exchanges that they had in the months before his death, in which Adi lamented that his illness kept him from doing everything that he wanted to do. Jamila said that she encouraged him and reminded him of his ongoing impact in the world, and that in true Adi fashion, he debated her. Later, he would follow up saying that he gained strength through meditating on the things that he was grateful for, and that he was re-energized by a new strategy to win on home care. Adi's passing was a sad moment in our fight for health care, but Jamila finished her remarks by saying that there is nothing more powerful than a movement of the brokenhearted. Jamila, I agree with you, but I want to add that without leaders like you, there would be no movement at all. This award is given to an individual who works to advance civility in society and social justice for all. Your ability to inspire hope when people are hurt, your determination to put power into the hands of people who don't have enough of it, and your courage to be bold, innovative, and inclusive of all voices is what keeps us on the path toward justice and healing. We share our times of grief and our moments of joy with each other because of the example that you set and because of the leadership you exemplify. Thank you for your advocacy, and congratulations.
Thank you, Wendell, and thank you, Ben. And is that the right one? No, wrong one. All right, this one, 50-50 chance. Jamila, it has been an honor and a pleasure to get to know you over the last few years. Adi brought a fierce moral urgency to his work that helped propel things, and I have no doubt after getting to know you that you have that same urgency, and that's what makes you so effective. On behalf of the Center for Medicare Advocacy, we are pleased and privileged to give you or honor you with this Chiplin Social Justice Award.
If someone had told 21-year-old AIDS activist me that one day a C-suite health insurance, former health insurance C-suite person would introduce me for an award, I would have said no way. But in all honesty, Wendell, it's been such a pleasure working with you, getting to know you, seeing your fierce clarity about what needs to change in our healthcare system. You're an important voice for our time, and we are really, really privileged to be able to work alongside you. I want to thank CMA for this incredible honor and say a little bit about you guys and what it's meant to work with you. We've been able to collaborate with the Center for Medicare Advocacy in the last few years, particularly on the Medicare Advantage fight. A few years ago now, me and Adi found ourselves enraged about what was going on in Medicare Advantage. And for us, we were now coming becoming aware of this huge problem that our friends at CMA had known for some time existed. But we felt like very few people understood the extent of the problem. Even the two of us who had been working in healthcare had very little understanding of what was going on with Medicare Advantage, and that almost no one was paying attention to the massive amount of fraud and abuse by health insurance corporations that was costing taxpayers tens of billions of dollars each year. But of course, CMA was already on the case. And minutes into a call with Judy and David, I remember Adi and I texting each other and being like, we found our people, you know? David and Judy and the rest of the CMA team, thank you for the many hours you've spent breaking down the intricacies of Medicare infrastructure and rules to us over the years. I feel like being really patient with my novice in this area. I thank you for the time that you spent strategizing with us and scheming with us about how to change this problem on Zoom mostly, for marching alongside us in the streets, and for sitting next to us in some boardrooms, whether it be meeting with the White House or CMS. And thank you especially for showing up for us in our time of immense grief in the aftermath of Adi's death, and stepping up in the work when we took some time to take care of our team and to grieve Adi's passing. It means so much to me to be recognized with this year's Chiplin Social Justice and Advocacy Award. I, unfortunately, did not have the opportunity to know and work with Chip, but he seems like exactly the right kind of combination of talent and deep care for others that we badly need more of right now, as we face down the most serious threats to our social safety net and to our health and well-being that this country has seen in generations. What an honor it is to receive an award in Chip's name and to be invited into this lineage of awardees I regard so highly as you continue to celebrate his legacy. Some of you who know me well know that I don't love giving speeches, so I'm going to cut to the chase here. I want to say more about this moment we're in, because I know many folks in the room and many of the virtual attendees are already feeling it acutely. Healthcare in this country was already in dire straits. We heard the story just now from Lisa and Joan. So many people suffering medical debt, too many people still uninsured, so many people skipping doctor's appointments, skipping doses of medications because they can't afford the care that they need. We were already in crisis. And I need now to be excruciatingly clear, so bear with me. Every single step forward we've taken together is at risk right now. Everything all of you have built, everything CMA has built over the years, everything that Chip worked on, and that countless patients and people with disabilities, elders, community organizations, and all of the unknown and unnamed heroes who have sat across from tables in offices, who have marched in the streets, who have worked to build and improve and deliver for all of us who now rely on Medicare, Medicaid, CHIP, or on the Affordable Care Act, and those of us who are counting on these safety net programs being there for us in the future. It's all at risk. And as you've already heard here, just this week, House Republicans released a plan to deliver $880 billion in cuts over the next 10 years to finance the extension of Trump's tax cuts for the wealthy. This plan outlines $715 billion in cuts from Medicaid and the Affordable Care Act, programs that together some 120 million people across the country depend on for health care. And meanwhile, and not unrelated, despite all of Trump and Musk's promises to tackle waste, fraud, and abuse in the federal government, in the 113 days since DOGE has been in existence, Musk and his team have failed to find perhaps the largest source of fraud in the federal government. The fact that the health insurance corporations are on course to fleece taxpayers of more than $1 trillion over the next 10 years through their fraudulent profiteering schemes in Medicare Advantage. Instead, Trump has proposed double the rate increase to Medicare Advantage insurers next year, while DOGE fires the already stretched workforce needed for oversight and accountability. There is no sugarcoating this. If Trump and Republicans in Congress succeed in advocating, in advancing this agenda, it will devastate all of us. Conservative estimates project that 8.6 million people will be uninsured in 2034 if this happens. The cost of healthcare will go up for millions of Americans. Hospitals across the country, particularly those in rural communities that are already struggling, will close. Nursing homes and healthcare centers that communities depend on will be shuttered. We will bankrupt the Medicare Trust Fund and put more seniors and people with disabilities in the way of deadly delays and denials of care by private insurers obsessed with their bottom line. Millions of people will forgo going to the doctor. Hundreds of thousands of people will be unable to get the home care they need or afford the medicines that keep them well. Many more families will be crushed under the weight of medical debt. Many, many people will die. The agenda that's being advanced is abundantly clear. There is a faction, a powerful faction of the Republican Party that wants to dismantle social safety net programs that serve America's most vulnerable and the working poor. They want to redirect the federal government and hard-earned taxpayers' dollars to lining the pockets of the wealthy. You see, oligarchs have no use for Medicare or Medicaid or Social Security or the ACA because they don't believe that these programs serve them. And they see government and all of us, the people of this country, as vehicles for serving them as they work to amass power and wealth. So yes, everything we fought for, everything we've won, it's all at risk right now. And yet, I have hope. And I want to tell you why. Adi, my friend Adi and former co-director of Be a Hero, quoted Rebecca Solnit ad nauseum, like to the point that I was like, you're really obsessed with her, you really need to stop quoting her. And now, in this moment, I found myself rereading her book, Hope in the Dark. And in that book, she says, to hope is to give yourself to the future, and that commitment to the future makes the present inhabitable. Anything could happen, and whether we act or not has everything to do with it. I have noticed wars will break out, the planet will heat up, species will die out, but how many, how hot, and what survives depends on whether we act. It's painfully true. There has never been another moment exactly like this one in the history of our country. But there's some good news. Musk might be the richest person in the world, but this country only has 800 billionaires, and there are tens of millions of us. We outnumber them. This is our power. It has always been our power. And the fight will be hard, and it will be exhausting. But my hope is not naive. I have hope, and it's not the one that's fluffy and warm and fuzzy. It's evidence-based hope, and I use that term because I'm in a room full of people who like to talk about evidence-based stuff. You know, I come from a tradition. I like to say I was raised by AIDS activists. I come from a tradition of health justice advocates that saw pharmaceutical companies were killing people with AIDS by pricing life-saving antiretroviral medicines out of their reach. Activists from groups like ACT UP in the US and France and the Treatment Action Campaign in South Africa, Health Gap, and many others around the world exposed pharma greed and took bold, relentless action in a fight for their lives. Here in DC, they staged sit-ins in government offices and they filled the streets with protests. They lobbied Congress and loudly shut down political rallies across the country. They even delayed the opening of the stock market. They got arrested, they got released, and they got arrested again. And they did not stop fighting until things started to change, until the drug prices came down here and for people all around the world. And then when I was 21 years old, I had just been awarded a Rhodes Scholarship. I was sort of on the top of my game. I finished college a semester early and suddenly became paralyzed due to the onset of a severe neurological condition called transverse myelitis. I didn't have health insurance at the time, and it was terrifying. These were the days before the Affordable Care Act. I ended up getting the care I needed and amassing more than $1 million in medical debt. And due to the kindness of strangers and a whole lot of luck, I received charity care that wiped my debt away. But I also knew I was now uninsurable in this country. Fortunately, I was able to take up my scholarship and go to the UK, where I benefited from the wonders of the National Health Service, a universal health care program. But because of the work of so many advocates who fought for the ACA, and particularly people with disabilities who put their lives on the line to fight for that legislation, a reality that at the time felt intractable shifted fundamentally. My pre-existing illness no longer disqualified me from getting the coverage that I needed in this country. And then 7 years later, in 2017, when Congress and Trump tried over and over again to repeal the ACA and rip health care away from millions of Americans, activists, led again by disabled people, organized, told their very personal healthcare stories, showed up and put their bodies on the line, and we saved the ACA. Courageous action delivers wins. It always has. It's the only thing that has. We have faced dire moments before this one. Together, we've held off threats to our health and our communities, and that's what keeps me in the work and what gives me hope. But I have to tell you, there is no room for people on the sidelines on this fight. Right now, we need to be braver than ever before. We need to be more courageous than ever before. This is the time. They're coming for Medicare. They're coming for Medicaid. They're coming for the ACA. They're coming for Social Security. And if they succeed in delivering on this agenda, it will devastate all of us, and it will take generations to recover. In an interview a few years before he died, Adi said that he was not optimistic about the future. He couldn't predict how it would go, but he said that he was hopeful about it. Adi believed that hope was not a state of mind, that it was a state of action. Optimism is hard. Adi said in a quote later, "Optimism is hard for me to find these days, but hope is another thing entirely." Rebecca Solnit wrote, "Hope is not like a lottery ticket you can sit on the sofa and clutch, feeling lucky. Hope is an axe you break down doors with in an emergency, because hope should shove you out of the door, because it will take everything you have to steer the future away from endless war, from the annihilation of the earth's treasures, and the grinding down of the poor and the marginal. Hope just means another world might be possible. Not promised, not guaranteed. Hope calls for action." So today, I want to take a moment. I want you to take a moment to answer this question. How are you going to take courageous action? Just take a moment. Think about it. What are you going to do? And then whatever action you imagine taking, I want to invite you to do something even more courageous than that. More courageous than you have ever done before. If you've never picked up the phone and called your member of Congress, now's the time to do it. If you've never gone to their office again and again and showed up outside there until they spoke to you, now that might be your next act. If you've never gone to a protest or occupied the halls of Congress, it might be time for you to do just that. If you've never been arrested for this cause, now might be time for you to do that too. This moment calls for us to take extraordinary measures, and I and millions of people across America need each one of you in the fight with me. Thank you.